everyone. Welcome to the podcast and interview of the Cleft Palate Craniofacial Journal. I'm Pat Chibbaro, happy to be the multimedia host, which is a funny title for me since I have no technical ability. But anyway, thank you for joining. I have a great paper that I wanted to talk with some of the authors about. And this is a paper that that you can find online first. I love these papers that have multiple authors that do a multi-site work together. And this paper is Publication Trends and Surgeon Perception, a comprehensive analysis of gender disparities in craniofacial surgery. And there's a great group. I want to name them really quickly and give credit to all: Molly MacIsaac, Iman Khan, Raphael Felix Tianco, Joshua Wright, Fatima Kamar, Carisa Cooney, Richard Redette, and Jordan Halsey. And I am lucky enough to have three of the authors with me. The first author, Molly MacIsaac, and then Jordan Halsey and Carisa Cooney. And Molly, before we got on, told me that she is you're a research assistant to Dr. Halsey, and that you're in the middle of finishing your med school so that you can do your plastic surgery training. Yay! Yay!
The goal.
Good luck. So let me ask you first, and whoever wants to take this, what I always love to know what motivated you to do this work. Whoever wants to jump in on that.
So I can start, and then I'll let Carisa also talk about some of her experience too, because I think this was sort of a combined effort. So I know the Baltimore team had been doing similar work with the direction of Carisa and some of their colleagues there up at Johns Hopkins in Baltimore, looking at a lot of the sort of gender disparities and differences in sort of females and males and other types of differences that we see in different subspecialties of plastic surgery. And I think being a pediatric craniofacial surgeon and sort of the experience that I've had and sort of what is, I think, perceived to be a little bit of a male-dominated field historically.
A little bit. A little bit. I told you having been the peds nurse practitioner for 34 years, starting in 1988. There were very few female residents or fellows or attending. So yes, I'm with you on that. Go ahead. Sorry.
This is something. No. I think you're very right on the money. I mean, I think over time we've obviously seen way more diversity in all regards within plastic surgery as a whole.
Yes.
But craniofacial surgery is definitely unique. We know a lot of the godfathers of craniofacial surgery, and there was a lot of a mentorship model that sort of instilled within that. But a lot of those original mentors and even the second and third generations were all male. And so now we're sort of involving a little bit more of a different look to the field, but that's something that isn't quite there as the paper sort of talks about, but is certainly something that we're seeing improvements on. Carisa, did you want to talk as well about this?
Well, generally speaking, I've lived in a lot of larger cities in my life, and so I've been exposed to more diverse population dynamics, right? Financially and ethnically and racially, and I think it's important to have that reflected in our workforce. And so the more studies that we can do to better understand these things, I think the better we're positioned to improve our workforce so that it is more representative of the patients that we're serving. And it's not that, a woman patient is going to go see a woman physician, but, people should have those options to see whomever is going to make them most comfortable. And we do see from research that's come out that if you are seeing the physician with whom you feel the most comfortable, you're going to have the best health benefits. So that's why I'm really excited about this work.
Great. So maybe you can give us sort of a walkthrough about the paper to give the listeners and the viewers an understanding about it. And definitely, I will tell all of you who are listening in, you should definitely take a look at this paper. I was really so glad to see it. So maybe give us a bit of a walkthrough.
Absolutely. So I think we had two goals with this paper. The first was to develop a baseline to understand in 2022 what academic craniofacial surgeons are publishing and use that in future to see temporal trends as we make progress in this field. So we defined a cohort of academic craniofacial surgeons, including attendings and fellows, and we looked through PubMed to see the number of first author and senior author publications in that year and come up with those counts. And authorship, senior first author, is a driver of your academic ascension in craniofacial surgery, and this is why we're using it as a proxy for this metric. And once we had an understanding of the cohort, we also wanted to survey craniofacial surgeons directly to understand their perceptions of where the field of diversity, equity, inclusion is. What can we do to improve it? How have things changed? What are some barriers? So it was a two-part project to kind of holistically understand where we are in 2022 and then what can we do to move forward.
Okay, so just maybe looking at your paper, what did you find? And I always love to know, were you surprised at any of it? Because sometimes you often are not, but sometimes you are, and that is that's I think that's something that's interesting to the viewers and anyone who's reading the paper. As I'm reading through, I'm wondering, oh man, what did they find? Because I know in my experience of, I was thinking back when I was reading this paper. And I know that I did not have a female fellow for many years, many years. And then I retired actually in 2022. And at that point, I had several female fellows and absolutely many more residents. And at one point, it seemed like I went into the room of all our residents and there were more women. And I thought, wow, the times have definitely changed. So maybe just in terms of what you saw, what were you not surprised about, maybe, and what was there anything that was a little bit of an eye opener?
Absolutely. Do you want me?
Yeah, you can go ahead and we'll tag on.
So for the cohort, unsurprisingly, it was predominantly male at 73%. And for the publication counts, we looked at average publication counts since there is an unbalance in the cohort. Males still represented most of the senior author and first author and total publications. So that was unsurprising, but this is looking at the entire craniofacial cohort. When we were interviewing and surveying the craniofacial surgeons, the respondents had an average years after training of 10, both in the female and male cohort. So this was a younger group of attendings who were balanced as far as training, and we did see much more equitable distributions of leadership positions and grant research involvement. And that was very encouraging because you see the lag phenomenon where we're making these improvements, but it takes time for all of these improvements to be seen. And then additionally, looking at the fellowship cohort, it is very small, so there's not a lot of statistical power that you can gain, but there was more females than males in the cohort that we looked at, and their publication counts were very balanced.
I mean, even when I interviewed for craniofacial fellowship, which was back around 2019, 2020, there were as many, if not more females. I think we were right at 50-50 on the interview trail. And now most of my female colleagues who I interviewed with are in academic roles. And a lot of the males went on to private practice or non-academic. So I feel like the paper sort of confirmed that we knew what we already knew about the field, which was there are a lot of, there's still quite a few instances where you can see males predominate, but there's a lot of improvement over time. And I do think the lag phenomenon is real in the sense that the younger craniofacial trainees, whether they be fellows or junior faculty, it is becoming more female. And the hope would be that this lag phenomenon doesn't kind of persist to be this glass ceiling type picture, but is
Right.
more that these women, as they enter the field, they're not just entering and staying in low academic roles. They continue to be promoted into department chairs and program directors and more predominant kind of roles in that. And I think that's the ultimate goal, is that we see, and not just related to gender, but, you know, race and ethnicity and other types of factors that Carisa alluded to. I think, you know, it'll be beautiful for our patients to be able to see physicians that look like them. And I think over time, we're working on that, and it's improving. So I thought the paper was it was a positive spin. You know, we didn't want to come at it and make it seem like, oh, there's just too many men in craniofacial surgery. But I think it's more showing that over time we're making strides.
Yeah, I mean, I did feel that way. I did not feel it was negative at all. I think that it really did show the trend. And no, I felt really good about it, and especially just historically, you know, having been, you know, sort of a part of it, to see those changes. There are a couple of things. One is that
Sorry, could
I'm
I
sorry.
add
Go ahead, Carissa.
something
Oh yeah, please. I'm
first?
sorry, I forgot
Um,
Carissa down there, over there.
so one of the things that I really liked about working with Dr. Halsey and Ms. MacIsaac was the fact that they didn't just do the analysis of the publications. They also included the survey piece. And it was very heartening that there was a good representation of men who completed the survey as well. And so I think what that really shows is this investment in the community, right, of craniofacial surgeons. And I think that is, you know, as they were saying, like very promising for the future of it, particularly given the political situations that are happening now moving forward.
Right. Krista, just talking about the DEI, and I know that you know, you've done a lot of different work regarding things like this. What did you find with that survey that that you expected, and then again, what was maybe surprising to you?
Um, Unfortunately, I don't know that I was surprised by anything in the survey.
Yeah, yeah,
So, but again, I love the fact that it wasn't just women responding. It was men also saying
yeah,
we need more resources to support good people who are going to give good care. And I think, you know, feeling more united in that front. Um, we definitely need he for sheers, and he for theirs, she for their, you know, all different directions.
yeah,
And, uh, you know, the one thing that I think we need to emphasize too, which is something that I've seen in the other work that I've done, is that we definitely still need our men in senior positions to advocate for everyone who's coming up behind them.
absolutely.
Um, and we wouldn't be where we are now without that support.
Yeah,
No, that's a go ahead, Jordan. Sorry.
yeah, no. I think that's one of the key pieces as well that I think was so interesting to see from the surveys, was that people talked a lot about the need for support and mentorship. And it's not just mentorship, but sponsorship, like having someone who's in an elevated position, whether it's your senior surgeon or someone on faculty, really say, hey, I think, you know, Dr. Halsey should speak at this conference. She would be a great asset to your panel, rather than me being maybe an expert on the topic. But if no one advocates for me to be in that role, I'm just going to be really smart, but in my office, hoping someone gives me an opportunity. And
Yeah,
there's a lot to be said for self-promotion, but without sponsors and people to really, like Carissa said, focus on promoting their, you know, kind of junior faculty or their mentees into these positions, it has to be an intentional effort. It's not a passive effort.
yeah. You have to be a
That's
little bit brave. You have to, I
yeah,
think self-promotion, and you know, having been in that world again, you know, I worked with many attendings, and of course I had a very different relationship with the attending. So for 25
mhm,
years, for example, I was the nurse practitioner who worked with Dr. McCarthy. You know,
mhm,
I mean, so and the residents would come to me and I'd say, you know, go, you've got something that you want to work on, go talk to him, and he was very supportive of the residents doing research. And even when he retired, he continues to come back to try to support that. But I think that idea, and I hope attendings, listen to this and read this paper, is to, again, because they're always asked to, to speak on, especially on panels, which are often invited speakers, as opposed to submitting an abstract and, and getting chosen, after a review. They're asking for you, and to have someone support one of their younger residents or fellows to put them in there, I think is really important. But it takes, having worked with many residents, it takes, because it's intimidating. This is like you're attending, or the director of your department. It's like, I don't want to be pushy, but I would say, knowing, knowing the attendings as well as I have, they respect that, well, most of them do. I mean, there's some ego out there, let's be honest, but I would say that, stepping up. And I think for you, Molly, it's going to be like, it's a game changer. I think for you, you go in with a whole different mindset, and I think it's a great thing. And for those of your age, in in your generation, to feel empowered to do that, to change this metric of, and I'm just so pleased with what I've seen over the years, for sure. One thing you mentioned, about doing some additional work. I think I read that towards the end of the paper. Are you thinking of doing that all together with the group that you're working with now, or doing different things? What can we see from you in the future?
You go ahead.
So yes, we talked about in 5 years, since this landscape is evolving so quickly, potentially repeating the study in the same method to see how the numbers have changed, because there wasn't any temporal reporting that we did in this paper, and you really can't say, are we making progress, are we not, if you don't have a benchmark. So looking at the same exact cohort and seeing how are women doing now compared to men in terms of publications, because then we're going to start to see this lag phenomenon and see how that is changing, and see how we might project as far as progress is being made, and then see if people's views on the progress has changed. And within the survey, it was the main takeaway was, we're doing a good job, we're making progress, but it's not where it needs to be. So we have to keep going. And that's why I wanted it to be positive, because I think you read a lot of literature talking about disparities, and it's very negative, and it's very heavy.
We're not there yet.
And I think
Stay positive. We got to stay positive, especially now.
Because if you don't, you're just going to get frustrated, and it's going to look like you're up against a battle that will never end. But I think, and really looking at the fellowship cohort, because that has been very well balanced over the last 5 years, just anecdotally.
I think it would be
total game changer. Sorry to interrupt. Total game changer. As I said, I was looking. I had a in my folders from when I retired. I still have boxes that I haven't unpacked 2 years later, and I had a list of all the residents and fellows over the years. And I'd love to send this. I don't have it. It stopped at a certain point, but it's like the early years. I would love to send this to you to show you what progress you've made. So stay positive. It's amazing. I remember the first year we had a female fellow. It was just like the minute as she started, I took her out for happy hour. I was like, you are the beginning. This is a good thing. This is a good thing, So, but I'm sorry I interrupted you, Jordan. We were talking more about the work.
No, I actually think it would be cool to add in like panel representation at meetings and like invited talks. There have been some additional research in other fields that you can see where people have actually started to look at that as well as a metric of academic productivity, and see, because I think what we find a lot with even female academic surgeons is a lot of papers, not necessarily an equal balance of first and senior author, but I wonder how many times they present research on abstract presentations, but then they don't present at invited talks and who gets
Right.
invited to these talks. And now I'm on like committees for organizations that gets to pick the panels, and you hear how it happens. It's all sponsorship. It's all saying, I like this person. I think they're great. They should be. So
Yeah.
I think it would be interesting to see how the sponsorship efforts and how younger female leaders in the field and academic, craniofacial surgeons are starting to be promoted by their mentors and things like that.
Yeah, very important. And one thing that I used to say to some of the residents and fellows is when there's a meeting that you get an announcement about, for example, so say the ACPA, I used to go and find who's the program chair for that, and I would literally contact that person myself about ideas for panels, because I'd been on a program committee for many years, off and on, and there were some times where we'd be sitting around thinking of topics, and it's again, it's self promotion, and getting some and other voices in, and I think that's really important too, because I've gone to conferences for the last 35 years, and sometimes when you see some of the same speakers, I'm thinking, no, let's have some new blood, some fresh blood, like let's see who's up and coming,
Yeah.
and you're right, that sponsorship is incredibly important. Before we wrap up, is one thing that I wanted to ask you, and I don't know who might have the data on this, or if you looked at this. You were pretty much looking at this in the U.S. and Canada. Any idea of internationally? Is it different in terms of the female workforce in plastics and all of that you were looking at in your paper? I was just wondering as I was reading it.
I don't personally have the data on that, but I can tell you that there are some phenomenal pioneers in craniofacial surgery that are female and that are positioned internationally. And I think specifically out of the Netherlands, Irene Matheson is like on, usually like president or vice president, all these committees. And she has, every time I see her at international craniofacial meetings, she's like, most of the time, like one of only one or two females on the entire board. But every time she's there with an army of females that are under her. And not that there aren't some males too. I'm not saying she's, prioritizing women over men, but I think there's clearly settings internationally where I do think you're seeing like an example of what I'm kind of hoping for. Carisa, has any of your research looked at any of the international community in plastic surgery? I'm curious.
Yeah, unfortunately, I haven't done that yet.
That'd be interesting.
Yeah.
That's a good point.
Well, I can tell you from, in the very beginning when I started, one of the, real pioneers was Dr. Ferman in Paris, who did the microtia surgeon. She was, revered by, everyone that, all the men I worked with. And, she would come and lecture at NYU. She was amazing. And I always thought that, 30 plus years ago when I first met her is, where please, we need more of you, we need more of you, and now we have more of you, so yay for that. I love my guys, but I mean, I think that because I've had patients over the years, parents who said, how come they're there's where's the women, and well, you're here, so, and you're here to stay, and it's and we need that balance, and as Carisa said, for patients and families to to really feel comfortable, we need to have that equity, we need to offer them, and certainly getting more surgeons in of color is definitely, because that's still clearly that's still not representative. So no, I think your work is just really important. I was really excited to see it. And so any last thoughts? Let me ask you this, Molly, as someone that's about to embark, and you're here. Where are you in New York? You're where are you studying?
Stony Brook, on the island.
On the island, all the way out there. Yeah, great. That's terrific. So and what advice do you have to up and coming students, residents, about how to how to get yourself moving through this process? Just what you're doing, and balancing it, because being a student and then doing the research in the middle of it, it's a lot. What keeps you going?
That's a wonderful question. I think the most important part of my decision to pursue plastic surgery and craniofacial surgery was a good female mentor and someone there who was excited, who was ready to teach and show you that it is possible to be a mother, to be a wife, and to be a surgeon, and to be a good one. And it's all over the literature that the number one reason that female want to pursue a surgical specialty is because they have a good mentor showing them that it is possible. So I think you need someone that's going to encourage you when there's hard days. And then you need to give that back to the people coming up to say, this is how I got through this. And then this is something that Dr. Halsey has helped a lot. And our partner, who is a male, has helped us see is advocate for yourself. We love to be collaborative. We love to say, oh, take a middle author and do a decent amount of work. But while being professional, advocate for your role in research, in group settings, because it is easy to kind of take a back seat so that everyone is happy and collaborative, which is challenging for me to do, but you can do it very tactfully, and it's something that needs to be done for your career.
Right. Great. Oh, thank you for that. That's terrific. I'm excited for you for your future. I can see it's going to be, it's going to be very bright. So keep up that great work. So let me just summarize. Let me give you viewers and listeners another idea of this paper that everyone should absolutely read. I loved it. Publication Trends and Surgeon Perceptions, a comprehensive analysis of gender disparities in craniofacial surgery. And I have three of the authors. There are many, which I love to see, but Molly MacIsaac, Iman Khan, Rafael Felix Tionco, Joshua Wright, Fatima Kamar, Carisa Cooney, Richard Redditt, Jordan Halsey. I want to thank Molly and Carissa and Jordan. But before I forget, they are from Johns Hopkins, All Children's in St. Petersburg. Looks like you had collaboration from Florida, from Johns Hopkins, Baltimore, and I also see a couple of other sites, Atlanta and Houston, right? So people, is that they were with you in up in or down in Florida? Well, I'm up or down in Florida.
Some were so Molly and then Joshua were here as our research assistants.
Gotcha.
And then Carissa also had research assistants as well. Iman and Raphael were up in Baltimore. And then obviously Dr. Redette is there as well.
I love it.
Yeah, I would say Fatima was also a research assistant. She even preceded when I started here at Old Children. So she was here as well. So we had a really interesting, and it's beautiful because all of our research assistants bring a lot of diversity, and it's kind of nice to hear their perspectives as well.
Wonderful.
It added a lot of value to the manuscript.
Well, I think it's a really important work. I look forward to seeing more, and I look forward to seeing this presented at conferences. So lots more work for you to do, but I want to thank you so much for taking the time to join me to talk about your work, and I'm really excited for what's to come. So thank you so much.
Thank you.